Hi guys, this is Charles. I'm one of the surgeons at Southpaws, and today I'm just going to go over CT scans, really unusual, with some findings in a dog that had a abdominal wall mass, and incidentally, the dog is feeling intermittently quite poorly, and it responds to antibiotics and anti-inflammatory medications, and so has this mass on the flank, and we've done a CT scan, see if we can figure out what's going on. So I'll switch over to the CT scan now. And so this is starting off cranially. So this would be the cervical region right here. The trachea is sitting there. That's the cervical spinal cord. That's one humerus, the other humerus. These are the two jugular veins here, and the carotid arteries are sitting right here. And so as we head farther caudally, the first thing that I can see is number one, there's a large lipoma in the left axilla. Now, the way that you can tell that it's a lipoma is that it has fat density. And so very similar to what you'd see on an x-ray, which is that fat tends to be black and soft tissue tends to be white or gray. The other thing that we can see is that we've got a lot of contrast material in the jugular veins there, and so that makes them light up really nicely. We have the trachea sitting right there, and we've got the esophagus sitting next to it here. Now, as we compare the left side to the right side, we can see that there's a mass in the right axilla and a discrete spherical smooth-bordered mass along with it. And this is probably the axillary lymph node here. And then this is just this weird kind of cellulitis mass right there. So you can see that it's contrast enhancing, but quite nebulous in its appearance. And so we head farther back, and it's right around and underneath the pectoral muscle. And then on the other side, we can also see this very large lipoma, which is sitting here. And you can see when you've got these two masses sitting side by side on the CT scan, you can see the very obvious difference between lipoma, which is this fatty density, and a mass or soft tissue, which is this kind of gray contrast enhancing density. We have the lung field sitting here, and I'm not in a lung window, so they're not going to show up as gray. Let me just see if I can, no, I was going to see if I could, that's not it. Anyway, I can't easily convert it to a lung window so that you can see what's going on there. And so as we head farther caudally, we can see lots of contrast in the great vessels in the cranial mediastinum, and this mass starting to dissipate as it goes caudal, but you can still see all this cellulitis here in the tissue. And so that's consistent with, not absolutely, but consistent with a foreign body or something like that. So often you see this kind of cellulitis when you have a migrating foreign body. Looking back here in the center of the chest, just to get you oriented, cranial vena cava sitting right here. We have the aortic arch. So this is the cranial-most aspect of the aortic arch. And as we head caudally, you can see heading into the aortic valve right here. And this is the descending aorta right there. And heading farther back, we are into the left ventricle here and the right ventricle there. And this is the caudal vena cava back here. You can see that this lipoma is still sitting here, so extending even farther back. Now, as we get farther back, so forward, heading farther back, we can still see a lot of this cellulitis in here in this tissue. And it really expands and extends into another mass with even possibly a fluid pocket sitting right in here. And so I am concerned that this could be a migrating foreign body, but I don't really see how these two masses, the migrating foreign body on the flank and the one that's in the axilla, are connected. Maybe there's a little bit of cellulitis connecting the two. So I guess it could be just a solitary foreign body that then has extended a draining tract all the way back here caudally. And you can see how extensive on the side of the abdominal wall that this mass is sitting. To review some of the anatomy in the abdomen, so this is liver here. liver all over here. This is cranial vena cava. That is the gallbladder sitting there. That's the portal vein sitting there. That would be stomach, getting into spleen right here. This is the right kidney, and then heading into the left kidney. That's colon, descending colon right there. And then heading farther back, we can see the transverse colon there, urinary bladder there. That's still spleen right there. This is a male dog, so that's the penis and prepuce in that area right there. Now let's see if I can, no, I'm struggling here to do a multiplanar reconstruction. But just to review the CT scan, I'll go all the way back up to the front here, and we'll just go through everything one more time. So now that you've heard me describe the whole scan, we'll go back one more time, and I can point out the specific abnormalities here. All right, so going from cranial to caudal. So we're just in the cervical trachea here. We've got the jugular veins here and here. We have carotid arteries here and here. These are the two shoulders. Heading back, we start seeing this really nice lipoma in the left axilla, and we have this mass developing in the right axilla. And this very well circumscribed mass sitting right here is probably the axillary lymph node, and then that's mass back there. Now, as we head farther caudal, we can see all of this cellulitis extending all around. And so that is, again, often I see that with migrating foreign bodies, but it's just unusual that we've got two discrete masses in the dog, one cranially and one caudally. So when we head farther caudal, this is in the chest or in the abdominal wall here. We've got all this cellulitis underneath the skin, possibility of a discrete mass right there. Just reviewing the normal anatomy, we've got spleen here, descending colon there. What did we do with this dog? Well, I've done biopsies of both masses, and I also did a deep tissue culture to see if it's some weird bacteria that's going on in there. Anyway, that's pretty much it for this review. So thank you very much for watching. And I'm not taking this dog to surgery, so it's just the biopsy. And if I remember, or if you guys remind me when those biopsy results come back, I'll let you know.